Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hi, Dr. Normington. How are you today?
I'm great. Good afternoon, Jordan.
Good. Hey, so today I wanted to touch on fillers a little bit more and discuss kind of what areas you specifically use each individual filler for.
Sounds great. So as we get older, we generally will lose volume in our face. And one great way to restore youth is to add or restore volume in the face. And to do this, we use a filler, okay? A filler usually is something called hyaluronic acid. Hyaluronic acid is something that everybody has in their skin as part of the structure of our skin. It's something that's synthetically made. It's a clear paste that we'll inject into wrinkles or lines to fill them in. So they're called fillers for that reason. And these fillers have evolved really over the last 20 years. Now there are probably 30, 40 fillers out there, and there literally are fillers designed for each specific place on the face. Like there are fillers designed for the lips, or there's fillers designed for the cheekbone. So we can customize a treatment for a specific patient, and we'll use a certain filler like Volbella in the lips, or we'll use a specific filler like Voluma on the cheekbone. And we can really very creatively restore youth for these patients.
Okay, great. Would you say that there's certain fillers or areas that you tend to use more than one syringe, or is it kind of dependent on the patient and the volume in their face?
I think it really depends on the patient. Many times initially, a patient will need multiple syringes of fillers. So Jordan referred to a syringe. So the fillers come in a syringe. Unlike Botox, which generally we can just give you the amount of the medication that you need, fillers are sold by a syringe. So when the patient comes in for a treatment, they're kind of committing to a number of syringes. And often at the first treatment, we will use more than one syringe. And it's different for every patient. But the bottom line is the more volume that we add, the more dramatic the results can be. But subsequent treatments are often usually just one syringe. It's a matter of kind of topping things off. Each syringe obviously has a cost. And the cost ranges anywhere from the $400 range up into the $800 range, depending on the filler itself. Some are more sophisticated than others, and the cost is a bit more. So when you come in for a consultation, Dr. Moyer or myself will sit you down and we'll come up with a game plan and be able to give you an idea of how many syringes of filler that would be necessary to complete the treatment.
Right. So would you say for someone who does end up having to purchase a certain amount of fillers or syringes, if they need touch-ups in the future and they haven't used that full final syringe that you used for their initial treatment, is that something that they would then use for touch-ups in the future?
Sure. Sometimes we'll leave a bit, almost expecting there's a touch-up. Like for instance, we commonly add volume to the lip. Lip enhancement is very popular right now. So we'll do a treatment enhancing the size of the lip and then leave a little touch left over to allow things to recover, maybe swelling go down, and kind of see where things look. And we can use that little bit at the end to touch things up or enhance the results.
So how long would you say that these fillers last then?
That's a good question. It really depends upon where they are. So places that don't move a lot, like the cheekbone or the lower eyelid area, I find fillers there last a long time, even a couple of years. Areas that have a lot of movement, like the lip, it lasts a little less there, sometimes a year or 9 months or so. And what's happening there, the constant motion makes the filler dissipate a little quicker. So areas that have motion, like the lip, it tends to go away a little quicker.
Right.
Yeah.
And would you say there's one kind of treatment that's most common amongst our patients, one area that patients get treated the most?
Well, I think the most common thing we see with aging is the smile line, the nasolabial fold develops first. So that's usually the initial area that we treat. But honestly, right now in younger women, lip enhancement's real popular. So I think honestly we're doing as many lips as other areas right now than anything else. Yeah. So
Okay.
lips are common.
Wow, yeah. And something else you don't see too often, but you do sometimes see patients with acne scarring and can sometimes treat them with fillers.
Yeah, so fillers fill things in,
Right.
and scars often are depressed. So it could be an acne scar. It could be a scar from trauma, or or a fall you had as a child. So if the scar is depressed, one simple treatment is to go in and add volume to that scar to fill it in. So for folks who have a lot of acne scars, we are able to improve things a bit by going around and injecting each of those little scars, adding a little volume to try to smooth it out. So that's something that it's a nice way to improve things. Fortunately, it's not permanent, but it is a nice way to smooth out the complexion a bit.
Yeah, that's great. And you'd say it'd probably last about the same amount of time.
Yeah, it can last a little longer, like a year or two.
Okay,
Yeah.
great. Well, that's all for today's episode then.
All right, Jordan, great questions today.
Thank you. That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.